Good afternoon, everyone. My name is Denise Octavia Smith, and I bring you greetings from Hartford, Connecticut. I'm a community health worker. I'm a patient navigator. I'm a survivor of a rare chronic disease. And in November 2019, I had the awesome honor of becoming the founding executive director of the National Association of Community Health Workers. Wherever you are, I want to thank you so much for carving out some time to be with us this afternoon. We have a special event coming up, and this webinar is part of a series and a larger initiative for the National Association of Community Health Workers to amplify the professional identity, the leadership, the capacity of community health workers, promotores, community health representatives, our peers, our outreach workers, and dozens of other work titles within our profession. I'm just excited about this afternoon. This is the third webinar in our capacity building series, and our project manager, Oscar de la Rosa, will share with you in more detail what those project goals are and what we're launching here at NACHW. This is very much the beginning, but I want to stop and say thank you to anyone who is a member, who is a partner. Sometimes we have board members on the call, our staff, Amari Watson and Aurora Grant Wingate. Thank you so much for partnering with us, for walking alongside of us as we unify CHWs across geography and ethnicity and sector and experience. Thank you so much, because as we come together and mobilize, as we come together to advocate, as we come together to advance and to amplify, we can support all of our communities, the families, the people that we care about, to achieve health, equity, and social justice. So with that, I want to turn over the agenda to Oscar de la Rosa. Oscar, thank you again for managing this project and coming alongside NACHW as a consultant, and thanks for hosting the webinar today.
Good afternoon, everyone. Thank you for joining us today. It's wonderful to see so many wonderful faces here. Welcome to our webinar. So, as Denise stated, thank you for my introduction. I am the project manager on this project, and I'm helping to work with all of our different CHW community health worker leaders who are with us, working in places all around the country, and they're wonderful community leaders who are advising and helping to lead this project. We have 3 project goals that we have broken down and have different leaders on each of those goals. Our first goal is to understand what the current state of is at the national level for CHWs within organizations, and what kind of leadership community health workers are being, what kind of positions of leadership are community health workers being utilized and partnered with across the country. So that's our first goal. Our second goal is to build the capacity of community health workers. And this webinar here is an example of that goal, which is to bring different opportunities for training, for growth, for hearing different perspectives that can help enhance individual community health workers and in the groups and associations of community health workers as well. Our third goal, which we will ask for your help today, you who are in this webinar, is that we are going to be interviewing folks who are not, it's called our non-CHW interview group. So our goal is to better understand what people in different positions of leadership or influence have across the country, what their perspectives are on the CHW profession, and how they can see, how community health workers could be partnered with and utilized to help promote health equity across the country. And so one of the activities that we'll have for you today that I'll have Denise help me with is we'll ask you to give us ideas for who you think we should interview for our national interviews. So if Denise, I could have you jump in and go ahead and lead that effort.
Yeah, for sure. You know, if you have ever been on a webinar with me before during this pandemic, you may have heard me say something like, despite 60 years of evidence of CHW effectiveness, a classification with the Department of Labor, a decade of research through the Patient Centers Outcomes Research Institute, a definition from the American Public Health Association, a classification as health providers in the Affordable Care Act. Community health workers still struggle with our professional identity. And it has nothing to do with us. There are thousands of us across the country. Our communities know us, families know us, community-based organizations, providers, legislators. CHWs are working across nearly every sector: housing, behavioral health, primary care, maternal and child health, chronic disease, HIV, the reentry community. But yet and still, there are many of those in influence, whether they are working in legislation, academia, research, health systems, who do not yet know who we are, who don't yet understand our unique qualities, our competencies, our capacity and skill, not just to deliver service downstream, but to transform systems, to advocate for racial equity and social justice. So the part of the project that Oscar described, which is interviewing these influencers, those who are non-CHWs, but who are developing policy in your state, who are in the C-suites of your hospitals or your federally qualified health centers. We want to interview these individuals and try to get some insight into what they understand and what are some of the barriers to their authentic partnership to advancing our profession. So if everybody can get with me on that idea, we need your help. I'd like for you to open up your chat and click on this for just a moment. And I want you to think about your state, if you're acting in your state. I want you to think about your national partners, if you are engaged nationally. I want you to think about your local partners, if you're operating locally. And I want you to brainstorm those who are not CHWs, but those who influence your profession. They employ CHWs. They write legislation about CHWs. They perhaps train or dictate the scope of work. And I want you to think about who NACHW should interview. Who should we sit with to understand what they currently perceive as our roles, our competencies and skill? Who should we talk to about what might be hindering their authentic partnership with us, or what knowledge they might need to advance legislation or our sustainability? So if you could throw those ideas in the chat. Now, they could be individual names, or they could just be names of organizations. And we'll follow up and try and figure out across sector what your best recommendations are for us and how we can represent your ideas on who we should be interviewing and consulting with. So take a moment, please, and just brainstorm into the chat. Should we interview hospital C-suite directors, medical doctors? Is there someone in your state who is a real champion? Is it the Department of Public Health or Department of Children and Families or Housing? So I see state Medicaid directors coming in. Tribes and leaders of tribes. Someone gave me name and address detail. Yes, thank you. I see you from the Oglala Sioux tribe. Thank you so much for joining us. Hello, Kathy. Who else should we be interviewing? Because I know you work across many sectors. Do you work in education? Do you work in public health? Are you working with an HIV population, a homeless population? Who influences your role, your profession? Medical school administrators, faculty at public health. Yes, I see that. Yes, public health administrators, I see that. Tribal health leaders. Yes, directors of student services at county and city schools. Okay, South Dakota Division of Medical Services. Thank you, Philip, for joining. Good to see you. I see folks joining all over the place. Public health directors, divisions of public health and behavioral health. These are the folks who are influencing the CHW profession. These are those that need to be our authentic allies. If they're going to be writing RFPs or NOFOs, if they're going to be hiring our profession or developing legislation that talks about our scope. The Commissioner's Court, absolutely. We are working in medical legal practice partnerships. We are helping people with immigration issues. We're helping people with eligibility of all kinds. Anyone else in this final moment? And then I'll turn the agenda back to Oscar. Thank you for joining us from the Eastern Aleutian Tribes in Alaska, Texas Department of State Health Services. Yes. Reform Alliance led by Van Jones. Yes, I'm aware of that. All excellent ideas. CHWs are everywhere. This is excellent. Thank you so much. You can keep these ideas coming as you join. We're asking who NACHW should be interviewing, non-CHWs who are influencing our profession. And I want to thank you for your partnership and just your brainstorm. I'm going to turn the agenda back to Oscar, and I'll ask him to share a video. And this is a video introduction so that you have some idea of who is funding this project. So this video is from Jorge Leon, and he is from the Johnson & Johnson Foundation. Jorge, thank you so much. I'm going to continue in the chat. Oscar, thank you for sharing Jorge's video.
One moment, some technical difficulties.
Oh, sure. We saw it for just a moment.
There we go.
Yep, we can see it now.
All right.
Hi, my name is George Leon from the Johnson & Johnson Global Community Impact Group. It's my distinct pleasure to welcome you to the launch of NACHW's National CHW Leadership and Capacity Building Project. One of the common threads through Johnson & Johnson's 130-year history as a company has been our continued steadfast support for nurses, midwives, and community health workers around the world. From our founding days, we have marveled at the heroics of frontline healthcare workers and the Herculean efforts they put forward each day to care for our communities. We want to support community health workers and grow them as a profession. As the last year has reminded us, having well-supported community health workers is a key to the health of our communities. This is especially true in communities of color, where we continue to see tragic health disparities. For centuries, people of color have been born with shorter life expectancies than white Americans and have been more likely to be living in fair or poor health. We believe we cannot have justice in society until we have justice in healthcare. That's why last year, Johnson & Johnson announced a new initiative entitled Our Race to Health Equity. Through this initiative, we aspire to help eradicate racial and social injustice as a public health threat by eliminating health inequities for people of color. One key way we're doing that is by investing in culturally competent community care models and supporting community health workers and the important work that you do. So thank you for your courage and dedication to your communities. We are proud to play a role in supporting you and all community health workers as we work to transform community health and achieve health equity. Thank you for attending today's event, and I hope that you enjoy it. Goodbye.
Thank you so much, Oscar. You can go ahead and bring up Michaela's slides as we transition. First of all, thank you so much. I'm seeing many introductions in the chat. I'm going to jump in and say hello as much as I can. But right now, I want to just set the stage and turn the agenda and the rest of the webinar over to someone who is certainly a colleague, becoming a new friend, although only virtually at this point, and certainly a mentor. And I think you'll find out why in just a moment. I want to introduce Michaela Trujillo. Michaela actually came on to NACHW's project before it was even really launched. In the summer of last year, we were looking for leaders across a very diverse group of CHWs and promotoras and CHRs. And we wanted to ask them about their engagement in policy, what they felt helped or hindered their work as a leader. And Michaela was one of the individuals that we interviewed. We were so grateful that after that interview process ended in the summer, that she agreed to stay on with NACHW. And so out of New Mexico, she joins us not only every month to help lead this project that Oscar has spoken about, that Jorge Leon is helping to fund, but she also is the co-chair of our capacity building work group. And she has helped to develop this webinar series. This is the third webinar in the series, bringing forward the expertise of the CHWs in our leadership group across the country, but also taking moments to confirm and to amplify the leadership of many of you, perhaps all of you on the webinar who identify as a CHW. I'm so grateful that Michaela is coming back for another webinar. Thank you so much for what you're going to do and what you're going to share today. And thank you for your leadership at the national level.
Thank you so much, Denise. You are just as much a mentor to me as you say I am to you. All right. Well, hi, everyone, and welcome to Translating Lived Experience to Becoming a CHW. My name is Michaela Trujillo. I am a certified peer support worker and community health worker, a NACHW leader, and a program coordinator at the University of New Mexico, Project ECHO. I want to thank you all for being here. I know I'm surrounded by friends, family, and supporters. Again, I have to start this off by thanking each and every one of you for putting the time and effort and being so thoughtful in registering for this event today. We asked you, what brought you to become a CHW? And the amount of input was overwhelming. I could have easily created a PowerPoint based off of all of these entries alone, with over 5 pages in total. But I hope that a few of you will recognize your submissions on the screen today. And I'm going to read out some of the submissions that made an impression on me. 1, I was the client who needed help. I was offered a job and fell in love with the work. That is the essence of CHW. Another is I was doing the work of a CHW before I knew what it was. Same here, me too. Is I want to serve less privileged individuals with a better health and well-being. And I appreciate that input as well. But there was more, so much more input. As you can see, that here listed quite a few times is lived experience, life experience and lack of assistance. I closely relate to that one. So as you can see, CHW gave most of us with lived experience a purpose. And in this last slide, we see things such as, I wanted to advocate for my family. It's been a calling. And my lived experience with homelessness. But mostly the most powerful thing on this is my son has major depression disorder. So as you can see, this is not my work. It is my passion. All right, so some definitions to remember throughout this presentation are lived experience. Anyone can have lived experience. Cancer survivors, COVID survivors, or all people with lived experience. And the second definition is a peer, which is often used in work and school areas to mean equal to in abilities. So in order to tell my story of translating lived experience to CHW, we should begin with this timeline. So as you can see, from 2009 to 2015, lived experience was occurring, including poor mental health, substance use disorder, and justice involvement. I was in survival mode, navigating community resources. In 2016, I was sentenced to the New Mexico Department of Corrections and began my journey as a peer mentor. In 2018, I was released from prison and began a career as a CPSW. In 2020, I received education and training for community health work and began a role as a CHW. In 2021 and beyond, I became a program coordinator at the University of New Mexico. I began advocating for lived experience, for state certification for both myself and others. This is also when NACHW leadership began. All right, back in 2009, while I was gaining lived experience, I had no idea that that's what I was actually doing. I was struggling in survival mode with lack of education, lack of role models, and I had been diagnosed with mental health issues and substance use disorder by the age of 16. I was heavily involved with the justice system and even went into my first stage of treatment at age 17. By age 18, I was left to navigate resources all on my own. Up until then, I had always had someone pointing me in the right direction, whether that had been a LADAC counselor or even a juvenile probation officer. But at 18, no one was there to help me find my basic living needs. And if you would have told me back then that the day I had to try to read bus routes and find the food stamp office is actually tools that they were going to teach me in CHW school later on, I would have never believed you. But it is exactly what that was, real life education. Fast forward to 2016. I was sentenced to 4 years in the New Mexico Department of Corrections, and I was sentenced to life, not death. Using the time incarcerated as a platform for personal and professional development by utilizing scarce resources in prison, such as GED training, creative opportunities for peer classes, small case management roles, and tasks such as reentry planning. I also began the campus's first mommy program, which was a parenting class for women. In addition to that, we held New Mexico Correction Department first ever week-long reentry conference, where the inmates actually were able to connect with the community resources that they would be utilizing on the outside. And in the photo on the right, you can see me pictured with my mentor and spiritual mother, Renee Chavez, co-facilitator of the peer classes and a continued support system on the outside. During my time incarcerated, I was making small steps to become a CHW. And in these pictures show stories of success and hope. The picture to the left is the Moms from the Inside Out graduating class, with the woman pregnant with the child in the womb. She was successfully reunited with her family after completing this class and serving her time in the New Mexico Department of Corrections. In the picture to the right, we have the gender-specific reentry class, where a woman pictured in the back row successfully completed supervision and found meaningful employment in her community, and she continues to be a strong support system for her family after serving her time in the New Mexico Department of Corrections. All right, on to 2018. This is when I was released from prison and seeking a position in the community. While grieving the loss of my father, who passed away from mental health issues and suicide 2 weeks after my release, I met with community leaders and began a role as a certified peer support worker and was given an opportunity at employment at a peer-run nonprofit as a job developer. I began a firm footprint in the community and built a lifelong network. This was my first opportunity to serve my community after release. And I'm forever grateful for the directors at the Albuquerque Center for Hope and Recovery for believing in me at an early stage of rehabilitation. The photos in this slide at the top is my first community health certified peer support worker certification and a newspaper article highlighting job development. I was actually able to assist a young lady that I was incarcerated with find meaningful employment in our community. After being a CPSW for nearly 2 years, I was longing for something further. I began to discover similarities of my life experiences to the case management positions within the nonprofit I worked for, and I was eager to put my hands in the masa, or dough, of CHW work. I stepped into a role as a CHW before I had completed training, and I was awarded the plaque to the right for the work I had done within the first year. I was introduced to NACHW and was able to share the experience with a 17-year-old intern who at this young age was in a program that will duly certify her as a CHW in her community while she received her high school diploma. Now we have reached 2021, the year when I was first introduced to NACHW by my previous supervisor and NACHW board member, Pageman King. I was nervous. I didn't know if I would find a voice in this group of national leaders. I was even nervous to commit to membership. I didn't know what I could offer a group of sophisticated CHWs from across the United States. Well, within the first 2 months, I found a place in survey development, thanks to Denise and Jane. I listened before I ever spoke up, and I heard things discussed that I had a valuable contribution in, such as diversity and policy making. I then moved into my role as a program coordinator at the University of New Mexico, a 3-year goal of mine. I dedicatedly met with NACHW at monthly meetings to hear the work being done in the many communities NACHW represents and offer expertise whenever possible. In April, I was formally denied on the state level for CHW certification in Albuquerque, New Mexico. My heart was broken. I heard once again that leaders in my community did not accept me. From that day on, I pledged to advocate for the many peers with backgrounds that I directly and indirectly support to hold a meaningful place in their communities and carry the CHW title with honor. It is with all of this that I am able to share this story of hope with you today. So how do we support turning lived experience into CHWs? This is a call to action. Now that you've heard my story, I cannot sit here and say that this is the recipe or formula for transitioning any person with lived experience into a CHW. However, it is the bare minimum of what needs to happen. People with lived experience have been counted out for many years out of minimum opportunities. We have low self-confidence and need lots of support to transition from a past way of living to the next. But the best part about this work is that it can be done. We do recover and people can change. Lastly, I'd like to leave you all with this ending quote. People with lived experience are often closest to the problem and closest to the solution, but often farthest from the resource. And if any of you are feeling particularly courageous today, I would love to hear what this quote means to you. Thank you all for allowing me to share my story with you today. It has been an honor.
Amazing. Sister, I just want to celebrate you and I just want to thank you so much. I knew it would be an incredible presentation. And the chat is also blowing up with a similar sentiment from "you better preach" to "thank you so much" to "amazing story" to "beautiful job." Let's just take a moment and celebrate. Share your reaction, put up a heart, throw something in the chat so we can share this with Michaela. This is our community. This is our sister. This is our colleague. This is someone who has shared her walk. And I know that so many of us can identify with aspects of this. Have you ever been denied even though you are competent? Have you ever had the experience that you knew you were the right person, that you knew you had a commitment, a heart, a desire to serve and lead, right? But we are here to celebrate Michaela's profession, her commitment to the profession, and we stand with you to say thank you for advocating and turning that experience of denial into just a moment in your timeline. And you're going to turn that right around and begin to continue to advocate, not only for yourself, but so many others. Honestly, the chat is continuing to blow up. So I'm just loving it right now. Thank you so much for sharing your story. Great job, Michaela. We always knew those stories are real. Thank you for sharing your story. What a great opportunity to motivate new CHWs to get engaged. You go, girl. There's just everything is just there. Thank you for your transparency and authenticity. And I see some folks are on or off. I see one of our brand new board members, Teresa. Thank you so much and welcome to the NACHW board. I see people shouting out that they are allies and have been allies for decades. I'm just scrolling through. There are many who are with us today. So we've got about 20 minutes left. So I know you may have questions about this moment, and Michaela has queued this up so well. Let me preface our discussion. We're going to enter our discussion right now by saying this. You know, I was a CHW in my city of Hartford, Connecticut, okay? My city is not that big. We think we're big. We're about 170,000 people. We have some of the worst health outcomes, high rates of gun violence, incredible poverty, incredible diversity in our state. But I was a CHW mostly working in HIV. I am a person with lived experience. I have been homeless. I know what it's like to be on the precipice and on the edge of substance use because of a rare chronic disease and prescription drugs that were given to me liberally. I know what it's like to be a single mother. I know what it's like to be in the system. And I was a CHW serving in Hartford, and the board of the National Association of Community Health Workers offered me an opportunity. And so it is such an honor to just create a platform where other leaders, my peers, my colleagues like Michaela, can elevate their own lived experience and expertise. We are up for the challenge, okay? Do not get us wrong. We have what it takes. Michaela shared with you the program and the experience that she created for other women while she was incarcerated. Her leadership, her expertise was already there before she got certified, right? This is important because we have to draw from that lived experience so that we can lift up others. During this pandemic, I have seen many things. Not only have I seen our communities be decimated by the economic effects, the mental health effects, certainly the physical effects. We've lost friends, neighbors, and loved ones. But I've also seen our profession be disrespected. I've seen our organizations not be respected for their capacity, for their leadership. And so this is what this capacity building series is all about. And I'm just so grateful for it. I want you to begin to throw your questions in the chat if you have questions. You may also want to come off mute and ask that question directly. And I want to invite you to do that as well. Just throw up a hand and I can call on you. But let's celebrate this time together and this leadership moment. And now let's cultivate the leadership that we have here. There may be allies on the call who want to ask a question. How can you center CHW expertise and lived experience? Or you may be a person with lived experience. How can you further your leadership journey? What type of support and mentoring do you need? So let me just scroll through. Lorna, why don't you come off mute and please briefly introduce yourself and ask your question.
My name is Lorna Osterbach. I'm Chagantagungan tribe. I am a community health representative, community health worker in Alaska down on Aleutian Chain. Being that Michaela is such a profound force and doing such a great job, it seems to me that she should be able to get some people to write up some kind of reference, so stating, you know, that look, this is what she has done in this short amount of time, and that should look at that and consider that and then give her license. I mean, I would think that that would be the number one thing, that if you get these references from people and say, this person made a big difference in my life, and these other people say, hey, this is what she's doing an awesome job, and it's so positive that they have to make a change. I would honestly petition them. I don't think anyone's probably ever centered that before, but honestly, you should. You're doing a phenomenal job.
Thank you. Thank you.
Lorna, thank you. And I know, Michaela, I know you shared just a little bit about the process, but, you know, can you give us insight? Did you get letters of recommendation? You know, what was that process, and what are you doing now? And are there ways that this community, that NACHW, that others can help? A lot of folks are putting in the chat, I'll sign the petition. So we might have to start a little Google Doc right now, but give us insight. How can we be helpful and understand this better?
Yeah, absolutely. Great question. Unfortunately, what is going on with the board of directors at New Mexico Department of Health, which is our credentialing board, is that they're just not really accepting my lived experience right now. They have unanimously decided that I did not have enough rehabilitation time. And when I asked for clarification on what would be a good amount of rehabilitation time, they couldn't really give me an answer. I continuously send emails saying that, yes, in fact, I am appealing this decision without any feedback from them. They are kind of ghostly working under COVID right now, so they don't have to answer to the same face-to-face interactions that they normally would.
Mm-hmm.
I have been more than willing to write up my own letter of explanation along with some letters of support. Something that our credentialing board likes to do is have you go dig up centuries old court papers and kind of like lean on that as to your way. Like, if you bring me all this stuff, we will certify you. And so I had a crazy deadline, which was within 24 hours to go dig up all these court papers. And luckily I had people who had compassion at the district court, and they're like, girl, we're gonna get you this stuff by lunch, and can you pull up? And I'm like, yes, I will be right there. And they actually provided me all the documents that were in question, and it was still a no at the end of the day. So I mean, I would love to share any kind of support in that. If anyone can help me get a hold of them at this point, that would probably be the best next step, because I have been working in smaller groups to try to get an advocacy team put together. So it's definitely in the works, but I will take all the support I can get.
So Michaela, NACHW would be honored to write you a letter of support. And I think we can take, I know there are other questions, Lorna, it's an excellent point. We can take some of the details offline so we can get to other questions. But if, you know, as you learn more about the process and these barriers, this is something that we will see repeated. It's not only something that's been repeated in the past, but now that states across the country are getting tens of millions, sometimes billions of dollars to hire community health workers. We know that this funding is coming through right now. The question for NACHW is, will authentic CHWs be hired? Persons with lived experience, with cultural relevance, with trust for the community. Will they be hired, or will we have others? Not to say that others are not well-meaning, but others are not committed to the profession. They don't have the lived experience. They don't know the barriers. They don't have the commitment. Sometimes they don't even live in the community, right? So we have real challenges here. Michaela, I look forward to working with you, whether it is a letter from NACHW or whether we put out a petition, girl, and make some real noise and some good trouble. And with that, I'll turn it over to Philip, because he's lifted up the elder of good trouble. And Philip, if it's you, I think we've been connecting on LinkedIn, and I want to say hello and thank you for reaching out. Any of you, please, feel free to reach out, because I love to meet folks. But Philip, why don't you come off mute and talk about your question or comment?
Well, yeah, thank you so much, Michaela, for leaning into vulnerability and sharing your lived experience. You know what I'm saying? Your story is definitely empowering, sister. But I appreciate the part when you mentioned the peer support specialist, because one of the things we're running into in North Carolina is there's a lot of folks that's confused between what the difference between a peer support specialist and a community health worker is, you dig? And so I believe, for us, it would be good if we could be united in differentiating the two, because there are a lot of similarities. I've been a certified peer support specialist for a long time, and then I took the community health worker class in 2020. And so just asking, what would you all say, anybody in here who is a certified peer support specialist, what would you say the difference between a certified peer support specialist and a community health worker with lived experience is, if there are any differences?
Why don't you start?
Yeah, that's a great question, Philip. And if you're just asking in my opinion, there really isn't that much of a difference, except one explicitly says lived experience and the other one says community knowledge of social injustice and inequity, right? So it's basically just tied into the wording there. But I think that in New Mexico anyway, the big difference is that you don't have to go through the background check that you would have to for CHW when you do a CPSW. There's none of that. We completely accept the background without question.
I think this is a critical question for national mobilization. I want to say a couple of things, Philip, and I think we've made this connection already, but one of my co-workers is on the call, Aurora Grant Wingate, and she has been hearing from her listening sessions across the country that many of our members would like some work groups so that we can more deeply and more better articulate what the needs are across different populations within this umbrella of CHWs. We often say community health workers, promotoras, community health representatives, peers, outreach workers, and dozens of other work titles. Some of this distinction comes from funding and comes from folks who are not CHWs, okay? This is one of the reasons that the National Association needed to come into being. It is not to discount the other identities that people have. We can be diverse and still come together and mobilize together, but there are some qualities, there are some competencies, there are some values that I think we all share across, again, geography, across ethnicity, across sector, across experience. And obviously it's my job to make sure that there is space for each one of us on this call and everyone else who shares these identities, who shares these values of self-determination, of self-actualization, of dignity and respect and social justice and integrity. So if folks are down with that, then you're down to be, a member of NACHW and maybe a CHW. But this is important, this mobilization. Let me turn it to Cassandra. Thank you for being so patient. I come from a long-winded family, so please, the floor is yours.
No worries at all. I'm just really curious. It sounds like a lot of you are from larger areas. How would you recommend implementing CHW programs or bringing in lived experience to more rural areas? My agency specifically, we do try to hire out of our welfare to work pool. Generally, that's mental health assistants. So that's people that are assisting clients with getting to appointments, doing grocery runs for them. So already a lot of the CHW stuff, I'm just looking how we could assist those folks more, moving up in the world, getting back in, into their sober life and living into their best opportunities. So if you have any recommendations of trainings, I'm actually currently taking the CHW training from Washington's Public Health. So I'm pretty excited about that, but it's not something that's really talked about in rural communities. And I think there's a great space for that to be made into a better program.
And Cassandra, where are you located?
I'm actually in Mariposa, California, just outside of Yosemite.
Ah, okay, wonderful. So I'll turn it to our keynote, our speaker, and then we can open it up.
Yeah, Cassandra, I just want to say thank you so much for doing the work that you do in such a rural community. We know how tough that is to be when there's limited resources and pretty much just limited belief in recovery in those small towns. I highly encourage, if there isn't a program or a training program created yet, create one. Make one exactly what you need, a facilitator and participant manual. And even if you started possibly like peer classes and kind of just let people discover themselves in those peer classes and see who rises to the occasion. And then you can take those ones and spend the special time with the training and moving them into like a internship and apprenticeship into that meaningful employment so that they get that one-on-one, face-to-face contact, hands in the dirt, appreciation for the work before we just throw them out in there and be like, all right, so you're managing this many caseloads and you're going to save the world today. But I'm definitely open to anyone who has a little bit more experience in, creating programs in rural communities.
I just wanted to mention that in Oregon, we had under the umbrella of the Oregon State, we had the community health worker, the peer wellness and peer support specialists, and then the doulas and the health navigator. We are on the same, but it's maybe some national level need to happen in order to, because how they define the peer wellness and peer support is people who has experience with mental health in addition. But many community health workers, we had a certification about the peer wellness and the CHW, and some of them, they had the doulas too. So we had, but we need more alignment on that certification at the national level because it is so much. There are a lot peer supported that they are CHWs already. So I just wanted to mention that.
Thank you, Teresa. And again, I just want to acknowledge Teresa as a new board member of the National Association. And so she and I are just meeting. I've had a chance to read some of her writing and follow some of her work, and I'm excited to have her be a part. I'm gonna, I see some other board members. Ricardo Garay is one of our board members and he's on the call. Paige Menking is one of our board members and she's on the call. And actually, Paige, I'm about to blow you up right now because, we've had conversations, around a workforce development committee. You were deeply involved in the CHW Core Consensus Project. And some of the questions that are being lifted up here or lifted up in the chat really do overlap or were addressed in the C3. So broadly, I want to talk about this, for CHWs, for peers, for authentic allies who are on this call, and they're concerned about these barriers, right? They're concerned about the way in which other people are assessing our skill, our competency, our qualities, our readiness to do this work. I want you to speak to some of the resources that the C3 has brought forward. Some may have not even heard of C3. So we won't be able to cover all of it here, but we can also throw out the recording, the chat of the recording link of the webinar that you helped to pull together, but address some of those issues because as I mentioned, the American Rescue Plan, there is an allocation of over $7.6 billion to reinvigorate and recreate an infrastructure for the future public health workforce. That involves many professions, but it explicitly names community health workers. And we are NACHW, we're a young organization. It's going to take all of us to advocate together at the national level, but also at your state, county, and local level to hold your state health departments and other private institutions who receive this funding to hire authentic CHWs, to partner authentically with our networks, our associations, our coalitions, our tribal CHR programs. So Paige, speak to what C3 can do it, how it can help us to bring this language forward and advocate.
Yeah, thanks, Denise. Happy to talk about some of the C3 stuff. Before I jump into that, I wanted to, well, it's all related, but I wanted to talk about to Chantel's question that she just put in the chat about job descriptions that lift up lived experience. And, you know, this is near and dear to my heart, as Michaela well knows. Before I left UNM, we were trying to get Michaela on board for a long time. And it was really hard to jive our thoughts about lived experience and our value of lived experience in the CHW position with the hiring requirements of the large institution that we belonged to. And so something I want to encourage all of the allies on here to do is to really try to transform the hiring practices of any large institution that you belong to. So beyond just things like background checks, which some institutions are coming around to having them be a little bit more case by case, not having these blanket background checks at the beginning, having, you know, ban the box, all of those sorts of really good movements for folks that have lived experience with the justice system, but also looking at education requirements and how you can substitute lived experience for education requirements, really challenging the leaders of your institution, especially if they are hiring lots of CHWs, to look at what those requirements are, figure out how you can change them and make them more equitable so that you can hire CHWs who really have this incredible, valuable experience like Michaela does, and have them as leaders in your organizations and not have to wait freaking 4 more years to hire them when you know they're ready for the job already. So I'll get off my soapbox, but I just really wanted to share that because I think it's really important, not just looking at credentialing boards, but also looking at hiring practices within institutions. And then C3, I think it is really important. One of the things we really uplifted in the project, so the project was really to find, you know, a common consensus, common language about how we talk about CHWs and the work that they do in the country. And one of the things we really uplifted is that the key component to a CHW being a CHW is their shared experience with the communities that they're serving, and that they come from the same place. They have the same lived experience. And that's like critical #1 in the definition of CHWs. And so when you're looking at hiring CHWs, starting a CHW program, it's so important to really be prioritizing that. The rest can be trained, right? We can train people in the skills, we can train people in the roles, but that shared lived experience, that compassion for the community, that desire to serve and help and live these values, that's what we want to find and recruit and hire for. So the C3 project does have these really great toolkits. So if you click through to the website that Aurora shared, you can find some toolkits, checklists for roles and competencies. But if you're having a hard time with your administration and the leaders in your organization, and you want to talk to them more about who it is that you're really trying to get to fill some positions, that's a really great place to start, using some of those documents and some of those toolkits to frame the conversation. So I hope that answered your question, Denise, or that I was talking a little bit at least to what you were hoping I could talk to.
No, that's fantastic, you know, and I think since we have some board members on the call, you know, we can come back to the board and talk about having a letter ready for folks who are, you know, wanting to have a discussion, you know, with an employer or with a state legislator, et cetera, to sort of provide and lift up these resources and lift up this best practice. You know, things like the C3 have been endorsed by organizations large and small across the country So things like this are very important. You know, again, if NACHW can be supportive, we're a young organization, but we desire to be in solidarity with you all who are lifting up this work. So I can't believe it's already 6:27. This is so good. We're just enjoying your company and your presence. So let's see if there's one more question. And then if there is, we'll take it. I want to see if there's anyone who hasn't had a chance to speak. And then I think I'll turn it to Michaela, just as a reflection. You know, if this webinar did what you wanted, you know, to do, this was your inspiration and you wanted to bring this forward, and you've brought this discussion forward to the NACHW community in such an exceptional way. Very much my colleague and mentor. So I'm just going to scroll through if I see someone's hand raised, because we've got 3 pages of folks who are joining us. Just raise your hand and I will give you a call. And I'm just scrolling through the pages. We have a question in the chat which says, can you speak to barriers like background checks or residency citizenship requirements as obstacles for folks with lived experience? This is another huge issue when we talk about centering shared and lived experience with the communities where you're serving, and knowing that particularly during the pandemic, folks are wanting to hire quickly, and we have all these barriers, right, on IDs, on documents. So Michaela, maybe I'll pass that to you and then let you have the final word for the evening.
Yeah, absolutely. I was working with, speaking with Ricardo in the chat now. So a little bit of background, like Paige has mentioned, I've actually got my current supervisor on the call too. And even he can probably speak to kind of having to hire under a definition of lived experience. Like you have to have a little bit of lived experience, but not too much lived experience, right? And so actually getting into UNM was a 3-year goal of mine. I had applied for various positions, various roles, and had quite a different amount of feedback. At one point, you know, I had just got out of prison. It was like, you don't have enough experience. Okay. And then I came back a year later and they're like, oh, nope, you didn't pass the background check. And I'm like, oh. And then another time was like, you don't have the education. And it is because of 2 individuals on this call today, Paige and Daniel Rowan, that I am able to have a role at the University of New Mexico. They believed in me, they fought for me, and they did not take no for an answer.
Yeah, calling out authentic allies. Isn't it wonderful, you know, to have a community? The chat is just exploding, Michaela. I'm distracted in a good way. You know, there's someone who is working at a state health department, I believe, who was saying that they're so honored to be able to listen in. He says, I'm a program manager at he or she at state health department, trying to write position descriptions for CHWs. And I'm so grateful for all of you and lift you up. CJ, I just want to thank you for sharing that. And for others, take these final seconds and just let us know what is the impact? Are you inspired? Was it just a wonderful hour away from work? Do you feel invigorated? Do you feel solidarity? How might you use this information? And is this, do you want to see NACHW doing more of this, sharing more of this? We're so grateful to have you. And I see so many faces that I'm seeing for the first time. Stephanie says, I'm fired up. I love that. Yes, this has been so helpful. Liesel says, more of this, says Shannon. This is fantastic. Yes. Well, we need you. We can't do it without you. And this is the reason we're doing it, to create a community where you feel welcome, where you feel seen and heard and supported, to go out and be the leader that we know that you are, to be the ally that we know that you are, to transform, heal, and advocate for your community. Zoraya, I see your hand up. Do you have a final thought? No? Okay. We'll not put you on the spot. This is so important, says Sharon. Yes, agreed. Michaela, thank you so much. Thank you for everything and for making this possible. Lorna, I see your hand up. Oh, okay. Good. Folks are good. One,
Hey,
All right, thank you all. Oh, go ahead, Joe.
yep. I saw Joe for just a moment.
hey, everybody.
Hey,
I am so sorry that I was late. My co-worker, Gloria McMaster, she couldn't get in, and I missed a lot to do. It did whatever I heard. It sounds so good. We are a community health worker in Greensboro, North Carolina, and we love our job. We love peoples, and we just like helping the resident in our community, and we mean a lot to the people because we have people even stopping us on the street, calling us, and just trying to do everything we can to give people resource, trying to do what we can do in the community. Even though we got this colon going on, we still doing a lot of things in the community, and our the clinic that we work for, they are very proud of us. The people's the people in general are very proud of us, the job that we do in our community.
Joe, thank you so much. Listen, we're just glad to have you. We know that folks are on the front lines, and we pray that all is well with each of you, with your families, with your communities. I would just want to take this moment. We are over time, and folks are transitioning, but listen, we are still very much in this pandemic, and wherever you are in whatever level of service, please do not forget to care for yourself during this time.
Yes.
All the love, the compassion, the expertise, the skill, the service that you have to give. If you're not well, you can't do it.
Right.
You can say, if mama's not good, nobody's good.
That's right.
I'm a mother of 4, so I know. Please, we want you to care for yourselves and care for one another. Lift up and remind one another to take a moment and breathe, to put that mask on, to wash those hands, to get vaccinated. Remember your own medications, your own self-care, your own medical appointments, your own prayer time, everything that you do in your spiritual life, in your natural life, to stay well. And I look forward to seeing each and every one of you again. Thank you so much. Oscar,
Thank you.
Michaela, Joe, Lorna, Gloria, Zoraya, Nicole, CJ, Raul, Philip, Stephanie, Shannon, Bev. Thanks to every one of you for being with us today. This has been fantastic. We'll see you soon.
Thank you.
Thank you.